Going live
Three.
in 3, 2, 1.
Okay, welcome to our live stream from Deuk Spine. It's November 7th. I've told you before we treat patients with scoliosis, and here's a perfect example. Can you see the x-ray, Sanjay?
Yes, I do.
You see the twisted spine?
Yes.
And that big thing, that computer, is inside her body. That's a pump. It's pumping morphine into her spine. Okay? All right, we're going to get started here. We're fixing the right side. Lay still. Let's go with the lateral view. Num num. Lay still. We're okay injecting local, right?
Yes.
All right. People ask me, oh, do you have to fix scoliosis? You don't. You just have to fix the pain. We're going to need a better job on the lateral there. Jordan. Shot. Shot. She's very twisted.
Stop moving.
I'm not so sure that's the angle we want. Can you make it better? First of all, yeah, we need to see. That's good shot. Let's get an AP. Okay, it's not bad. Let's go back to a lateral. You can see the challenges that scoliosis creates by changing the alignment of the disc and where it projects and getting access to those discs. She's not a heavy woman. She's actually very thin. I think this is going to be our 2-3 shot. Shot. Got to stop moving. I'm talking to her. Jordan, you're going to have to change your, it's not going to be a true lateral. You realize that. It's going to have to be wagged pretty heavily to get a true lateral for her. I don't mean orbited, I mean wagged. Can you look down the disc? Did you spend a little time doing that before I got here? Okay. I need you to get a true lateral. All you're doing is changing the orbit. Go ahead and get an AP. Okay. Shot. All right. Now you see the disc space there? Is that true lateral disc projection? No. So what are you going to have to do with this fluoro to go look down the disc space, side to side, from the left to the right? What are you going to have to do with this fluoro? Huh? You're going to have to wag it. Big time, right? And you're not doing that. You're just orbiting it. This is going to be an orbital and a wagging challenge. All right. Shot. Shot. So I need to see the pedicles. Yeah. Take a look at above the needle. Show me with the arrow. See that? That circle right there? Go up. Nope. Up. Go to the left. To the right. You see that oval just below your arrow?
Yes.
That oval needs to line up with the other one to the right. Go to the right. See that oval right there? You just passed it. That oval right there. They need to be lined up together. So you're way off on orbit. I'm not sure how much more you have to fix, but shot. Shot. Every time you take a shot and she breathes, you lose it. All right. I think that's getting a little better, but let's see if you can do some more on the orbit. You may be maxed out. All right. So you're maxed out. Let's get an AP. All right, well, the AP is not too bad. I've never had to navigate primarily off the AP. Shot? That's like right there where the entry is to the foramen.
She got a very small disc space.
Shot? Yeah, she has a collapsed disc, that's why. Shot? Shot? So let's see. We're at 5, 4, 3, 2, 2, 3. Can you give me a little bit more of an AP? Shot? That's better. Shot? Huh?
It's a contraption.
It's a pain pump. Shot? Basically pumps drugs into the spine.
Directly into the spine.
Shot? Alright. Give me a lateral again. Shot? Try the other way. Bring this side up. How are you guys doing over there, anesthesia-wise? All right, keep going. Shot. Keep going. Shot. Keep going, you're almost there. Keep going, shot. That's about right there. You see that? Shot.
She's had a lot of C-spine fusion too, so it's a little bit hard on the
On the neck, shot. Yeah, I bet it is. What is it? Shot. Shot. The problem here isn't the scoliosis is not the cause of her pain, but it is making it very challenging for me to get into her disc space. I'm hitting this bone. I'm not able to enter it. Shot? Shot? Yeah, it's hitting the back of the spine. How's she doing?
She's doing well. We lost the EKG. We're just fixing a lead, that's all.
Shot? Give me an AP. So remember that lateral position, because that's pretty darn good. At least at 2, 3, 5, 4. All right, so we're way out, away from the spine. Let's go back to a lateral view. I'm basically hitting her transverse process. Shot. Her spine is so far over.
With having such severe.
Let's get another AP. That's better. Let's go back to a lateral. If I could just get in that foramen. Shot. Shot. Just cannot get around it. I'm going to try coming from a little bit higher. Shot. Poor thing. All right, let's go back to AP. There's so much scoliosis that it's making it very hard for me to get into the natural opening of the spine that's there, called the neuroforamen. You can see I'm hitting the bone spur right there. It's actually very good on the AP, but there's some bone growth right there that I'm not able to get past. So let's try again. Let's look at the lateral. Might be able to come a little bit further laterally. I'm making a pin cushion out of her, unfortunately. Shot. That more promising. Shot. The trajectory looks fantastic on a lateral view, huh? Shot. Look at all that arthritis, incredible. The amount of arthritis, I just cannot, it just keeps hitting bone. Poor thing. All right. Shot. Just keep hitting this wall of bone. All right. Try a little bit more. not, we're just going to go to the DPR. Let's get one more AP. So 5, 4, 3, 2, 2, 3. Way too lateral. Shot. It's just same thing. I'm hitting the bone. I just feel bone. Shot. Let's try a lateral view. Shot. I just feel like I'm too high. I mean, the pedicles look like they've lined up nicely at L2. The problem is L3. I'm not seeing the pedicles good at L3, which might be okay, but I'm hitting bone every time I try to go further south towards the feet, which I want to be further south. Just keep hitting that bone. She has a lot of arthritis bone from her facets. Well, I mean, I think you've done a great job there, Jordan, at 2. Let's see if you can get the pedicles of 3 lined up a little better. Let's wag. You're going to lose 2, so remember where you were, but be prepared to come back to it. But let's see if we can't find, no, the other way. You think that's better? No, it's probably worse, huh? Phenomenal. Try a little further. Just see what happens. You're hitting the table? Shot? I almost feel like that's better. What do you think? Huh? I wonder if I can get to it a little bit higher. Shot? Is that it? So I'm too far south. Shot? I like the pedicle above. 5, 4. It almost looks like 5, 4, 3, 2, right? 2, 3? That's what it looks like to me. Shot? We'll have to check on an AP, but oh, it's just all bone. There's just, I'm trying. All right, try an AP again. I mean, there it looks good. I could be a little inferior and a little more lateral. Go back to a lateral view. The AP view is perfect, by the way. Thank you. 5, 4, 3, 2. To me, that's 2, 3. 2, 1, 12. It's just incredible. Shot? Not making any progress on the lateral view. I think we're too medial. Shot? Shot? Oh, I'm finally making some progress here. Let's see, shot? Let's see where that is on the AP. Because it looks pretty good on the lateral, but it is forcing my needle lateral. Oh, by the way, on a scale of 1 to 10, this is a 12 out of 10. Yeah, this is too lateral. The bones of the facet, the arthritic bones of the facet are forcing me lateral. 12, 1, 2, 3. We're definitely at 2, 3. Let's go back to a lateral view. We're too lateral though. Just cannot get in. It's just all bone there. She doesn't like it either. There's just no way in. So full of arthritis. Shot? All right, we're going to have to do our DPR. I cannot get in. I'm going to have to do the DPR. All right, let's just go to the DPR then. AP. And we're doing our right 4551, correct?
Correct.
And since her pain is up a little higher, I'm going to do 3-4 as well. All right. So we cannot do the DLDR. It's not possible to get in. But we can do the DPR. Don't move. How's she doing? All right, Jordan. 12, 1, 2, 3. So try to show me that right side a little more. Good. 12, 1, 2. I need to see the pedicle of 3. I think I see it right there. Man, that is incredible. Shot. I think I see the pedicle of 3 right there. 5, 4, 3, 2. I see 2. Where do you think the pedicle of, the transverse process of 3 is? That's 1, that's 2. I think that's 3 right over there somewhere. Isn't that incredible? Shot? I think I'm headed right towards it. That's it right there. Shot? I think I'm on it. Could be a little more medial. Let's give some numbing medicine. Yeah, take that.
You have your blade,
Take that?
blade,
Yeah. All right, folks. We're trying to make the best of our situation for this woman. She has horrible back pain. Definitely a lot of it's coming from her facets. So if we can get her facets treated right now, I think she's going to have some good relief. Shot. We've just got to get. There it is. That's actually the best. Let's see. What is that? 2?
2, yes, sir.
All right. Well, that's right where her pain is. I'm going to treat that over here. Don't move so much. Move your hand. Shot. Okay.
You guys have a little local, or? Yes,
We did. We already did it. Shot. Oh, we realize that. What do you think about general anesthesia for her? Shot?
No.
Huh?
That's a no-go.
No go?
That's a no. Not here, at the hospital.
Shot? So that's the perfect location. All right, so that's 2. Shot. All right, I've got to see the 3. It looks like it's right there. Wouldn't you agree? Show me where you think the TP of 3 is. Yeah, that's what I think too. All right, so I'm going to aim for that. And the problem is her scoliosis has moved everything completely out of where we would normally see it. And I feel something right there. Feels like a TP shot. It's too low, right? That's going to be 4, wouldn't you agree? That's amazing. I'm all the way at 4.
We have a question from Ali Cameroon on YouTube.
Sure, shot.
Does this kill the pain completely?
Yes, it does. Yep. Yeah, if you're able to get to the target, which we can for the TPs, but we can't for the disc. We've tried. It's not possible to get to the disc. We tried. Her anatomy is not allowing it. Shot? But we did get to the, we are getting to the facets. Shot? Let's see where that is. No, Jordan. Shot? I feel the TP. Shot? That looks really good. All right, now 4. I feel good about 3. We got to do the next one down, which is, I think it's 4. That generator is getting, that pump is getting in the way. All right, let's find the next one down. Wow, it's incredible, huh? That's probably worse. Again, shot. I mean, that looks like the TP right there. Where do you have it? Yeah, that's what I think too. So if I can make it there, I think we'll be good. It's just incredible. I treat scoliosis all the time, but this is the worst case I've ever had. Shot. This poor woman. This is the worst. 5 minutes. Shot. And we still have the next one down, right?
Yes, we were supposed to go down at 5-1.
Let's go down to the next one. I could see S1. Jordan, can you show me? I need to see the facets. All right, that looks like 5 right there. That's actually pretty good. If you could just keep that right there, I think I can work with that. Let me see the probe. Shot. All right, I'm going to go ahead and do another incision. Let's have a needle. Shot. Move your hand. Further south. Shot. To medial. Shot. All right, so we're going to use the needle to find the target, which is a bone. Shot. That's pretty much it right there, huh? Oh yeah, I feel it. It's right there.
Yep, do it.
So we got that target plus one more below.
So we did L1, L2, right?
We did 2, 3, 3, 4, 4, 5. We're going to do 5, 1. 2, 3, 3, 4, 4, 5, 5, 1. And the reason is because it turns out her scoliosis is so bad that all those upper facets are actually all by where the L4, L5-S1 is. So we're doing more than we plan to, but that's because I think that these facets are actually contributing to her pain. All right. Move your hand, shot. All right, it's to inferior medial, shot. Shot. What do you think about that, Jordan? It's pretty close. Shot. Huh? It's right there. Move your hand. Shot. That feels good to me. I'm right on bone. I think that's it.
We have a question from Ali Cameron on YouTube.
Shot. Yep.
Does inflammation from facets ever cause the radiculopathy?
Great question, Ali. The answer is yes. I've seen it happen. It's not common, but it does happen. Facet inflammation can definitely cause radiculopathy. Not common, but doable. Shot. That looks like a really good spot. One minute left, or sorry, 3 minutes left. Got one more rhizotomy to do. Shot. Shot. What's your hand? Shot.
We have a question from Earth Body Official on YouTube.
Shot. Uh-huh.
How long does the pain relief last?
Well, if we get the nerve to the facet joint burned, the pain relief is permanent. That's what we're trying to do right now, is get that nerve. That's the perfect spot right there. It's called the medial branch of the dorsal ramus. And in this case, at S1, it's going to be the L5 dorsal ramus. And I'm trying to just destroy that pain nerve, and that's going to give her a lifetime, the rest of her life, relief. So, let's see. Hopefully that did it. That should be it. Thanks, everybody. Well, unfortunately, we could not do the laser at the disc because the holes where the nerves come out were completely closed off by arthritis. And I wasn't able to get in. Let's put some pressure, Luis. A little pressure dressing, because I think she was on some kind of thinner. Not clotting completely normally. But we're definitely able to fix the facets, and I think she's going to have really good pain relief of her back pain. So we'll see how she does tomorrow. Great questions, and we'll see you all Thursday.